and welcome to this evening's webinar. Before we get started, we have a few housekeeping instructions to share with you. Spanish interpretation will be available and turned on at the conclusion of these comments. Please select the language interpretation channel by clicking on the globe icon at the bottom of your screen. We also have enabled the live script transcript and can be accessed by clicking the CC icon on your screen. Buenas noches y bienvenidos a todos. En un momento se activará la interpretación en español para esta reunión. Si desea escuchar esta sesión en español, por favor, hacer clic al icono de globo terráqueo en su pantalla. Transcripción en vivo también puede ser activada haciendo clic en el icono CC. It's my pleasure to get us started this evening by thanking all of you for joining us for this important conversation. My name is Ruth Fernandez, Executive Director of First Five Contra Costa. We at First Five are committed to ensuring all children 0 to 5 grow healthy, ready to learn, and supported in safe and nurturing families and communities. Some of you might be partners of First Five already, or you might know us from our First Five centers, which are places for families to come together, learn and grow together about their children's development and learn about their community. If you're learning about us for the first time, be sure to click on our website, first5coco.org, at the end of this webinar. I invite you to visit our First Five Center closer to you. Okay, so let's move on to why we're all here tonight. We're here to talk about COVID-19 vaccinations for children 6 months to 5 years of age. Last year, we hosted a webinar to share information on keeping our children safe during the pandemic, and it was widely attended. And given the recent authorization of vaccines for our very youngest, we want to bring you the information to support you all through this process. We have asked a panel of experts to join us tonight to answer the many questions that parents have asked about the vaccination and to ensure that you have the most up-to-date information available to you. We're also pleased to have our very own First Five Commissioner, John Jones, who is also the Executive Director for Coco Kids here in our county. He's agreed to come back and be our moderator for this webinar this evening. Thank you, John, for joining us, and I'll turn it over to you.
All right. Okay. Thank you, Ruth. As Ruth says, I'm the Executive Director over at Coco Kids, which is the Child Care Resource and Referral Agency in Contra Costa. So if you need childcare, we're the people to go to. We will give you a great referral. And the same way, if you need help paying for it, that's what we're there for. I've had the pleasure of serving on First Five for a number of years. I almost lose count how long I've been there because I see a lot of good work being done. One of it is our efforts to make sure our kids are safe. It's hard to believe it's been over almost 2.5 years since any of us even heard the word COVID-19. And earlier last year, we were able to bring you the head of health services to talk about the importance of vaccines and any questions that came up. And it's taken this long for us to get to the point where we can have something safe for our youngest kids. As a parent, it's always been my interest. My first priority has always been to keep my kids safe. This falls in line with your efforts to make sure your kids are going to be safe and healthy. So we do have a panel of experts. I wouldn't say I am one of them. I would say it's a panel of experts and John. So let me introduce our experts. We have Nikki Burrito, who she's a nurse practitioner who's been practicing pediatric primary care in the Bay Area for 17 years. The past 10 of which have been with Contra Costa Health Services, serving East Contra Costa County, where I live. She currently also serves as the Director of Public Health Clinic Services for communicable disease. Sophie Mercura is a doctor who is a pediatrician who has been practicing in the Bay Area for the past 10 years. The past 6 have been with the Contra Costa Health Services clinics, She is currently the Deputy Health Officer for Contra Costa County, the COVID-19 Operations Section Chief, and the Medical Director for Contra Costa Public Health Department, and she also serves on the First Five Commission. So welcome, Dr. Makura. And then last on our esteemed panel, we have Omnihi Omotoso. Dr. Omotoso is a general practice pediatrician practicing in West Contra Costa County for the past 10 years at the William Jenkins Health Center as part of Lifelong Medical Care Operations, or the organization, where he serves as the Associate Medical Director of Pediatrics. He also serves as a member at large representing Contra Costa and Solano counties on the local American Academy of Pediatrics Northern California chapter. And he's vice chair in the Department of Pediatrics at Alta Bates Medical Center. So as you can see, we have a very experienced panel, a very rich in years and experience panel, and I know we're going to be able to answer all the questions. So to kick things off, one of the things we used to like to do with at the commission is start meetings off with a question to keep us child-centered. This keeps us in thinking about what's most important here for the next hour. So the question I'm going to throw out to the panel is, when you were a child, what was your favorite toy? My favorite toy was a yo-yo, and I could guarantee you that this was not my mother's favorite toy because it also caused a lot of damage in our house. So nurse practitioner Burrito, what was your favorite toy?
I really enjoyed my Etch-a-Sketch. I could create stuff and erase it and then start all over again. Yeah, I'd say Etch-a-Sketch was a top one in my list.
Excellent choice. Dr. Mercuria, what was your favorite toy?
I really enjoyed a miniature piano that I had in my room. I'm sure my parents didn't enjoy it because I played it at night all the time.
Okay, and Dr. Omotoso, what was your favorite toy as a child?
It was a Lego set I had. It was just a basic one, but you could make anything out of it, just using a Lego machine.
All right, so one of the criteria we always have here is all of us have to have been a child for at least a certain period of time. So we met that criteria. So let's move on to the presentation. Nurse practitioner Burrito will lead us through a presentation. And then after that, we're going to do questions and answers. And we are going to be looking at questions that have been frequently asked through surveys and at the clinics. And then if we have time and you want to type something in the question and answer box, we will respond to those at the end. So go ahead.
I'm going to give Sophie a chance. Oh, there we go. All right. Well, hi and welcome to our presentation today about, or discussion really about COVID-19 vaccines in children. So thank you for that wonderful introduction, John. I really appreciate that. Sophie and I work very closely together. So next slide. And we're very pleased to have Dr. Omotoso join us today for our Q&A panel. Next slide. So today's discussion, we're going to talk a little bit about what does COVID-19 currently look like in Contra Costa County right now, and kind of the history of vaccines for children. Before we dive into the 2 available and approved COVID vaccines for infants and toddlers, what those benefits and safety profile and kind of the clinical trial data, what that looks like. And then we will talk about how do I get a COVID vaccine? Where are they available? How can I access that before we jump into our Q&A panel with our providers. Next slide. So let's start off with looking at the case rates in Contra Costa County. And as of this week, this graph shows us the case rates broken down by age, and you can see that the 0 to 4-year-olds are that top bar, and they are a significant driver of cases in Contra Costa County right now. This is really, you know, our babies are getting COVID. They're not immune to this. It is affecting this age group. Since March of 2020, there have been almost 400 Contra Costa kids under 18 who've been hospitalized, and about 42% of those have been in this age group, in this 0 to 4 age group. And if we back up a little bit, we see that those numbers are pretty dramatic across the United States as well. Almost 140,000 kids in the United States have been hospitalized with COVID. 1,709 of those kids have died from COVID since the beginning, and 529 of those were in the age group 0 to 4. The 0 to 4 age group had not been eligible for a vaccine until recently, and so really excited to be able to have a safe and effective vaccine that we can help protect the kids in this age group now. Now, COVID is now, there's sometimes there's a misnomer, misunderstanding that COVID isn't really affecting our kids, but COVID is now a top 5 leading cause of death in children, and this is pretty significant. This is right up there with accidents and drownings. And now that we have a vaccine for this age group, this COVID can now be added to a vaccine preventable disease list. Besides death and hospitalizations, which we are very worried about, we also worry about kind of longer term effects or even severe impacts of COVID. In the United States, there have been over 8,000 cases of COVID-linked multisystem inflammatory syndrome, which is MIS-C, and 70 of those kids have died. 25% of that were kids in this age group, the 0 to 4-year-olds. And we know from studies that the vaccine can help protect kids from MIS-C. In teenagers, we're seeing that even up to 95% of teens that were hospitalized, they were not vaccinated. The majority of kids who are hospitalized are not vaccinated. And so you have an opportunity now. We're also concerned about long COVID. There was a national survey in the UK showed about 8% of kids with COVID, even with mild symptoms of COVID, reported experiencing long COVID. And long COVID is where you continue to experience symptoms or fatigue much longer, sometimes months later after infection. And so we know that COVID, even in mild cases, can have an impact on our kids. Next slide. So this graph is showing our COVID-19 associated hospitalizations among children 6 months to 17 years old, and it's broken down by age. So this kind of spike towards the edge of the page there, that's during the Omicron surge in kind of the January, February era of this year. That red top spike, the biggest spike of kids who were hospitalized, was in the 6 months to 4-year-olds age group. So having an opportunity to vaccinate this age group can really make a difference in this graph. Next slide. We also know that the severity of hospitalizations is important to look at too. So this graph is showing us that, again, that red color is that represents the 6 months to 4 years old age group. And we see that they had the highest rates of requiring ICU admission or requiring oxygenation or a ventilator to breathe while they were in the hospital. And that the severity we see by this that the severity is is higher than in some of the older age groups. Children under 5 were hospitalized 5 times more during the Omicron surge than they were during Delta. We are also seeing that 6 out of 10 children who ended up hospitalized, they didn't have any underlying health conditions. So it wasn't the kid who had multiple medical problems. These, 6 out of 10 kids were completely healthy kids without any indication of a risk for severe disease. Next slide. So the history of vaccines, we currently vaccinate kids for a variety of diseases, polio, measles, hepatitis, whooping cough, chickenpox, meningitis. And if we look at, the current data shows that we're still seeing about 300 deaths per year in children who are not vaccinated of these vaccine preventable diseases. When we look at just COVID alone, COVID has killed killed 1,709 of our children in the US alone in just the past 2 years, which is way more than all of those other diseases combined. So COVID is still a pretty significant risk for our children. Next slide. The vaccine approval process in the United States, this slide kind of shows you the different steps that vaccines need to go to. And this is all vaccines, not just COVID vaccines. They start out with a review of the scientific information. Scientists and doctors meet together in the FDA advisory panel to discuss the clinical trial data and discuss the vaccines. Once they've made it through that approval process, then it goes to the CDC advisory panel to get approved, which then the CDC also reviews all of the information, and the scientists and doctors review that as well. Here in California, we have an additional step that vaccines go through, and it's our Western State Scientific Review Work Group. So it's an additional review panel of scientists to look and doctors to look at the safety of that vaccine, and B, the effectiveness of that vaccine before we even get those vaccines in arms. So this is where we're at today, is that the 0 to 4 the 6 months to 4 years old vaccines had gone through this very vigorous process. Sometimes vaccines will go through and they will meet with the FDA, and sometimes the FDA will send them back. We saw that with Pfizer early in the year. Pfizer, when they presented their initial data, the FDA panel said, you know what, I think we need to get a little bit more information before we approve this. They sent Pfizer back to collect more clinical trial data and then present it again before they would move it through the process. So this is a very vigorous process. All vaccines, including pediatric vaccines, go through this vigorous approval process. Interestingly enough, the COVID vaccines have had more robust studies on them than any vaccine in history. So very interesting to know that we have a system set up in place that is really monitoring and looking at that. Next slide. So I'm going to start out by talking about the Pfizer vaccine. There are 2 vaccines that are available for this age group now. There's Pfizer and Moderna. So let's take a look at the Pfizer COVID vaccine first. The way that both of these vaccine developers, they both started out figuring out what dose would work best for this age group with the least amount of side effects. And so they look for the dose that's going to work best for this age group, and then they start moving on to the next phase of the clinical trial. So they spent many months looking at what's the smallest dose that will work and is effective without side effects. So without as higher rate of side effects. The Pfizer clinical trial had 4,526 trial participants, and it was broken down to about 1,700 infants of 6 months to 23 months old, and about a little over 2,700 toddlers aged 2 to 4 years old. What they found were the most common side effects were mild to moderate, and they're usually lasting about 1 to 2 days. And they're similar or even less than what we saw in the older children, the 5 to 11 age group and the teenagers. And just like all the other age groups, it was most likely after the second dose. In this Pfizer trial, particularly, about 50% of infants and toddlers were fussy for a day or two after, and about 30% had a sore arm, and about 30% were a little tired, but less common were fever, headache, chills, and muscle aches. They compared the pediatric antibody response in these younger children to the older age groups, where we know that the vaccine is effective in these older age groups. So comparing how the body's immune response, how the body immune system responds to the vaccine, and by looking at that antibody response, and it was very comparable to the older age groups. They also did these studies during the Delta and Omicron surges, and so they found that these vaccines are effective against Delta and Omicron as well. Next slide. So the vaccine for Pfizer it's a 3-dose series, and it is a smaller dose. It's 1/10 of the adult dose. So it's still the same vaccine. It's just a much smaller dose. There were no serious reactions in the study. And like I mentioned before, the immune response to the vaccine was the same or similar to the older age groups. Pfizer did present an 80% effectiveness in preventing symptomatic COVID among children aged 6 months to 4 years old. However, when we look at that data, it is a little hard to really deduce the true effectiveness, just purely based that the number of children who had COVID during the study just didn't really meet the scientific threshold for we look to have a certain number of cases where they can say with more confidence that it's an 80%. So this 80% effectiveness is kind of a preliminary number, but we do know there were no COVID hospitalizations and there was no deaths during this clinical trial. So when we talk about effectiveness in these vaccines, we're kind of talking more about, did they initiate the same response in their immune system as compared to the older children where we know there is effectiveness there too? So we're looking for that same immune response. Pfizer did deliver that. Next slide. So Moderna, let's talk a little bit about the Moderna. Moderna had more, they had a larger sample size. They had 6,607 trial participants, about 2,300 of them are infants, and for a little over 4,000 were children 2 to 5 years old. Similar to the Pfizer, side effects were mild to moderate, about 1 to 2 days, similar or even less than what we see in older children, and most likely after the second dose. They did see a little bit more with the sore arm, about the same for fussiness and fatigue. They did have some fever. Less common were headaches, chills, and muscle aches. Now, Moderna did report that there was one incidence in the study participants of a child who had a febrile seizure after their first dose. Now, we know that febrile seizures are very rare, but they are a side effect that can possibly happen even after other childhood vaccines. So this is not unique to Moderna, but this particular child didn't have any problem with the second dose. Now, febrile seizures, I know they can be very scary for parents, but one of the reassuring things about febrile seizures is that they are not dangerous. And children are absolutely fine afterwards. In the Moderna clinical trials, the pediatric antibody response was the same as comparable to the older age group. And it also was found to work against Delta and Omicron. Next slide. The Moderna vaccine dose is smaller. It's about a quarter of the adult teen dose. So it is the same vaccine, it's just a smaller dose. We talked about that febrile seizure we talked about that in the last slide. Also, like I mentioned before, that same immune response, looking at, did the vaccine initiate a similar or same immune response to the vaccine in these infants and toddlers as it does in the older children? And it does, it meets that criteria. Moderna was a little bit a similar problem where they had difficulty getting enough cases to be have like significant effectiveness data. So this 51% effective really is difficult to compare to Pfizer, apples and oranges. It's also, Moderna is a 2-dose series. And so the kids who received Moderna are reaching the same immune response to the vaccine as older kids did after 2 doses, whereas Pfizer is reaching that after 3 doses. In the Moderna clinical trials, there were no COVID hospitalizations and there were no deaths. Next slide. So, we have a whole bunch of COVID vaccine safety. I mean, starting with that first age group of the adults and moving through kids, we have many, many months of real world safety experience to using this exact same vaccine. Hundreds of millions of people in the United States, 16 and older, have been vaccinated, and millions of children aged 5 to 15 have been vaccinated. Here in Contra Costa, over 90% of our county teenagers are fully vaccinated, and 65% of our children aged 5 to 11 in the county are partially vaccinated and on their way to fully vaccinated. So, we have lots of real world safety experience using these vaccines in kids. Go ahead. So myocarditis and pericarditis so myocarditis is a rare heart inflammation, and there were some reports of this happening in teens and young adults, and it's typically in males aged 12 to 30 years old. It was mostly after their second dose. And out of over 100 million vaccines given, there were only 2 cases reported in the 5 to 11-year-old age range. There were only 428 cases among the 12 to 17 years old. This side effect was not seen in any of the vaccine studies because it is so rare. And so there's some thoughts about that this is mostly tied to puberty in boys, and that this is likely even going to be even more rare in, if it at all, in the 0 to 4-year-old age room. These cases of this heart inflammation from the as a secondary effect from the vaccine have all been mild, and they were all self-resolving with no long-term effects. Of these rare, like I mentioned, of these rare cases, they were mostly in the older age groups. They're in the 16 to 30-year-old particular boys. And that rate dropped in the 12 to 15-year-olds, and it's almost 0 in that 5 to 11 age group. So next slide. Now, I do want to take a moment and just discuss the difference between a vaccine-induced myocarditis versus like a classic myocarditis or a myocarditis from actually catching the COVID virus and having an infection. Now, COVID infection can cause myocarditis, and this type of COVID infection, myocarditis, is much more severe and has a much higher mortality rate than compared to a vaccine-induced myocarditis. So about 20 to 30% of hospitalized COVID patients will develop heart problems because that COVID virus affects the cardiovascular system. The vaccine-induced myocarditis is much, much milder. These kids recover fully in typically a few days, but no, in less than about a month. So when we kind of put it in perspective, for every 1 million boys or young men that are vaccinated, we would expect about 40 cases of myocarditis, but it would be mild and go away in a few days, and that we would have prevented a whole lot of hospitalizations and ICU admissions and deaths from COVID because the vaccine is protective against that. So just kind of putting it in perspective that the myocarditis is there, we do know about it, but it is extremely rare, and it is mild and self-resolving. The risk of getting a much more severe myocarditis from catching COVID is much higher and much more significant. Next slide. So why do we vaccinate? Why are we recommending this? Well, these vaccines are safe and effective. We know this. There's lots of data on it. We have full confidence with these vaccines. We know that vaccination protects kids against hospitalization. Most of the kids that are hospitalized for COVID are not vaccinated. And now we have this opportunity to help protect our 0 to 4-year-olds. We know that vaccines help limit the spread of COVID. We know kids tend to get less sick than adults, but they can still get and spread the virus to others who are more vulnerable. And the more people who are vaccinated, the less COVID spreads, and the less severe illness, severe disease, hospitalization, and death we see. So next slide. Where can I find a vaccine? This is a great question. Now, we have lots of information on our website, cchealth.org. If you get to go to our vaccination page, There's info and scheduling links to community partners. You can go through your pediatrician, your healthcare provider. Pharmacies are offering it. Some pharmacies are limited to vaccinating only 3 years old and over. So if you're interested in getting a child vaccinated at a local pharmacy, just ensure that they are vaccinating the age of your child. There's community vaccine sites, and we also have county vaccine clinics across the county as well, and those sites are listed on our website. We are also public health, Contra Costa Department of Public Health are partnering with the community agencies like WIC and First 5 and Head Start and Cocoa Kids. And this has been a great partnership, and we will be helping run these community-based vaccine clinics at these sites across the county in partnership with the community agencies. Next slide. Cocoa Kids is having a vaccine event on August 20th and September 17th. This is open to anyone age 6 months and older. We'll have even grown-up vaccines too. So if the whole family can come and get vaccinated, walk-ins are welcome. And there is a way to make an appointment on there, but they do take walk-ins. Next slide. And First 5, in partnership with First 5, we'll also have several clinics throughout next week and the end of July. And so I believe First 5 will be sharing this information as well with everyone as well. The vaccine clinic is open to those under 5 and also their families. So First 5 families and community members can come to these vaccine clinics as well. Next slide. So I wanted to say thank you so much for joining us tonight. And we have been kind of collecting questions over time, just as we've been going. And so we want to have an opportunity to answer some of those questions. I will leave it up to John to kind of start us off on the next portion, which will be the Q&A.
All right, thank you, Nurse Practitioner Brito. That was a lot of information, and what's great is we're recording this, so if you want to go back, you'll be able to collect all that, and we'll also be sending out links and a lot of the information via email, so you'll be able to get it there. So we do have some questions right here, and if we don't have time, if you have a question, go ahead and put it in the chat, and if we have time, we'll answer it. If we don't, we'll try and get you an answer anyway, because I know a lot of this stuff is really critical. One takeaway from the presentation is that COVID is very much still a part of our lives, even though we're not hearing about it on an hourly basis on television like we used to. We don't have the shelter in place and people are going out and about on with their lives. The rate of infection is still very high. So the question we should all be asking ourselves is, how do I keep myself safe? How do I keep my family safe? So Dr. Mercuria, what is the difference between the COVID vaccine and other vaccines children get? Can a child receive multiple vaccines at one time?
Thank you, John. That's a great question. The COVID vaccine is the one for pediatrics is an mRNA vaccine, which is a technology that's been around for a while, but it is one of the newer vaccines that has been used. And other pediatric vaccines use different systems, essentially how they work, and they have different vectors that they use, but essentially they all work similarly in mounting an immune response for the individual, and all vaccines work in that way to make sure you're protected. What was the second part of the question, John? Can you repeat it?
Can a child receive multiple vaccines? So you know how sometimes you take your child to the doctor and you get a lot of shots at once. Can they do that with COVID?
Yeah. And for the COVID vaccine, so I would say, although it's an mRNA, it's very similar to all the other vaccines, and we have a lot of information about it. It's been tested. This just happened that COVID came around, and it was the perfect opportunity to use this this thing that's been researched for a while, and this vaccine enabled that to use it. You can get many vaccines at the same time, including the COVID vaccine. And so if you're due for your vaccinations, we would actually recommend that you get them all all at the same time, and there's no issues or problems with that.
Okay. I know as an adult, I got my flu, my COVID, and my tetanus all at the same time. And my arm, they did both arms. So I was sore for at least a day. Dr. Omatoso, I know that people tend to have a medical home. Hopefully they have a primary physician. So can a parent take their child to their regular healthcare provider to get the shot, or do they have to schedule it someplace else?
Yes, they can. Most pediatric offices have been getting the vaccine so they can give to patients on their visits. And like Dr. Mikuria said, if they're also due for other vaccines, it's a good time to go in so you can get all of them at the same time. And so we're encouraging everyone to call their doctor's office to see if they have a particular schedule or if it's something you can just walk in and get any day of the week.
Okay. Okay, so it feels like we've had to keep a scorecard to keep track of all the variants. So nurse practitioner Brito, do the vaccinations work against new COVID variants or other strains that arise, and how many strains are there?
Gosh, I've lost count on how many strains there are. The clinical trial did they did do a lot of their investigations during the Delta and the Omicron wave. So we do know that these vaccines are effective during against those variants. This is something that the doctors and scientists in the CDC, they are all keeping an eye on very closely. We know that even if the virus mutates to where it kind of evades or works around our immune system to actually catching COVID, we know that the vaccines are helping keep people out of the hospital. It's helping prevent severe illness. So even if you've been vaccinated with a new variant, there is likelihood that, it may still be infectious, even if you're vaccinated, but the vaccines are helping keep you out of the hospital and keep death off the table. So that's a really significant impact, and a really important thing to remember is that we are likely not looking at preventing all cases of spread of COVID. It helps reduce it, yeah, but may not prevent every case of COVID, but it's definitely going to help keep your kids out of the hospital and from dying. So important thing to know. So good question.
Okay, all right. Dr. Mercurio, there's a two-part question here. One, can you stop sharing the screen so all your wonderful faces will fill up the screen? And then two, you talked about side effects, and I think that worries a lot of parents, with the side effects. Are there any other long-term effects in younger children under 12 that we know of? And can children with food allergies get vaccinated?
Great question. As mentioned, there was only mild side effects to the COVID-19 vaccine, and also very similar side effects that we see when you're vaccinated against any other standard vaccine: fussiness, some fever, some sore arm. In terms of, there's no long-term side effects from the COVID vaccine that we know of at this time, and we don't expect necessarily to see anything, but they do continue to monitor all vaccines for a very long time just to ensure no concerns. I forgot your second, so you're not good at second parts.
Can children with food allergies get vaccinated?
Children with food allergies can definitely get vaccinated against the COVID-19 vaccine, and in fact, many all the childhood vaccines at this time, you have no issue with that in terms of getting the vaccine if you have an allergy to food.
I'm guessing that question kind of came out of, because isn't the flu vaccine based with eggs or something?
Yeah,
if
and
you have
then
an allergy to eggs.
there was an egg allergy for the flu vaccine, and there's actually slightly different recommendations for the flu vaccine based on the allergy type, and so even that has evolved.
Okay, so it's smart to ask questions
Yeah.
and make sure before you give it to your child. Dr. Omatoso, why doesn't the vaccine keep you from getting the illness, like the measles? You get that shot, you don't get the measles. You take mumps, you don't get mumps. But it seems like people are still catching COVID even though they've been vaccinated.
Yeah, it's kind of a couple of things that contribute to that. One of the things is usually the vaccine induces your body's immune system to learn how to fight a particular infection and then keep a memory of it. But there are some kind of infections, unfortunately like COVID, where your body doesn't keep a memory of it for too long. After a while, your body forgets exactly how to fight it. So for something like measles, that works. Your body sees it once and you can remember it almost for a lifetime. We have whooping cough. You remember it for a while, maybe 8, 10 years, and then your body forgets and you don't respond as well. Unfortunately, right now, we think COVID is kind of closer to the flu, where your body responds, but after a while, you forget how to respond to it. So that's one of the ways we think it happens. Another part of it, like Nurse Practitioner Brito mentioned, was the variants are changing. And so even though you can respond based on the memory your body has to the vaccine, if the new variants change enough, they'll be quite different. So you may not be able to prevent yourself from getting infected. But the good news is that because you still have that vaccination, your body is able to adjust and fight it enough that you don't get really sick or end up in a hospital.
Okay, so does that mean as the variants change, as those come out, we should be paying attention to whether or not we have to get a booster shot for our children?
Yes, so we'll have to continue to pay attention to that to see if we need booster shots. Yeah.
Okay. All right, Nurse Practitioner Brito, will a child need to stay out of childcare after getting the vaccine? Like, is there a period of time they should stay away from other kids?
Not at all. Some kids, if they're a little uncomfortable or maybe feeling feverish or maybe feeling fussy, may want to stay home to treat some of those symptoms. They're very short-lived, usually less than a day or two. But most kids do totally fine and don't have any side effects. I will tell you, my kids, when they got their COVID vaccine, they went to swim practice an hour later and then went to school for that whole week and had no problem. So there's no need to stay away from other people after the vaccine. The vaccine is going to do its magic in the human body without needing anything else going on. Just live your normal life.
Okay. Yeah, I know a lot of childcare providers told me that young children don't understand what social distancing means. They have their hands all over each other. Encouraging that is hard.
Oh yeah, they're sharing germs like crazy.
Yeah. All right, Dr. Mekaria, I'm sorry, I'm just butchering your name here. If a child under 5 years old recently tested positive for COVID, what is the guidance on when or whether they should get the vaccine?
That's a great question. If a child or really anyone tests positive for COVID, we do expect them after they clear the infection to have some kind of immunity COVID, but we would recommend that they get the vaccination as soon as they can. So if they're due for their vaccination or if they haven't or due for a booster, which is right after they kind of clear their infection. And that's just because we do know that your body does have some kind of immune response and able to fight COVID after the infection, but we don't know how much that is, how good your immune response is. There's a lot of things that is different in everyone, but we do know the vaccine really does help and will even boost your immunity more. And we have seen that in individuals who had COVID and got their vaccine. They just have a slightly bigger immune response and boost. And so we would recommend it right after when you can get it after you kind of cleared your COVID infection.
Okay, all right. Back to Nurse Practitioner Brito. Do you have any tips to prepare a young child for the vaccine?
I'll say that the young babies, they are my best customers. Babies take it with a grain of salt. It's usually the moms. I will say when my kids got their first baby shots, even though that's what I do for a living is work in pediatrics, but I still, wanted to hug and hold my baby. There's no, or the older kids, the kind of older kids, I think the biggest thing is not to amp up to it, but also to be honest too. Yeah, we're gonna go get vaccines, and then afterwards, let's go get a treat. Or here, I bet they have stickers at the clinic. Or here's distraction can also work with some of the toddlers. Sometimes not drawing it out, just getting straight to business. getting it done, and then they realize that, oh, that didn't even hurt, and now I have a sticker, or I have a coloring book, or oh, mommy's going to take me for a cake pop, I know that's the tradition in our house, is after we get vaccines we go get cake pops. Um so those are some things that can be helpful. Also, the nurses that are there vaccinating the children, they often have a lot of good tips that can help share with parents. Things that that have worked for your child when you've gotten other childhood vaccines. Use those techniques as well. Your child best, and if you've had that experience with other types of vaccines, this is no different.
And, I went and got my booster the other day, and a woman was there with 4 kids. And my advice is, don't let the other ones watch the first one get their shot, because the minute the first one got the shot, the other 3 took off. And so she had to bring them back in there. So privacy is key.
Yeah. Yeah. We also give out bravery badges, which are Band-Aids. I mean, in our clinics, that's, being brave is also reinforced as well too.
Okay, excellent. Dr. Mercuria, do the benefits of the vaccine outweigh what getting COVID infection is for kids?
So as we kind of saw in the presentation, the benefits of vaccine definitely outweigh what COVID is to kids. And I know that we've heard a lot that COVID doesn't really affect kids the same way. COVID is pretty mild, but that's not necessarily true, as we saw in the data that Nikki presented, that children are affected by COVID. They can have really severe outcomes. They can be hospitalized, and it can cause death. And I think a lot of what we were seeing initially, or why people relate COVID to not being that much, is because they compare kind of COVID to adults, which does have a lot more in comparison to children outcomes. But we do know in children it can cause death at a much higher rate than we see with other vaccine preventable diseases. It can cause a lot more hospitalization, and it can cause other outcomes like multi-inflammatory syndrome in children, and long COVID, that even after the infection. And studies have shown that vaccination could also prevent or protect you from those kind of other outcomes from COVID.
Okay, all right. The next question comes from our audience, and any of you can answer, or maybe all of you have an opinion about that. So you've talked about vaccines being one of the primary ways to protect a child from the virus. Where does that land with masks? Are they still important? Should we still be using masks, or can kids stop doing that?
I'll take that. Yes, I think it's important we still do that. Even adults and adolescents have been vaccinated for a long time, and we still have them wear masks. Because like Nurse Practitioner Brita said, even if you're vaccinated, you can still get COVID. And with the high rates of COVID we're seeing in the community, the more we continue to practice the same precautions, the better it is for us, and the less likely we get bigger surges of infection. Because even if you don't take those protections and you get COVID and you're vaccinated, you may not get sick, but you could then transfer it to someone else around you who is maybe more vulnerable or not vaccinated, and they could have serious health consequences. So at this point, especially if you're going to be out in public, kids going to school, going to the grocery store, I would still continue to maintain social distancing and wearing a face mask.
Okay. All right. So as you talked about earlier, Dr. Omotoso, this might be a good question for you too. So for the younger kids, is the size of the dose smaller than what the older kids are getting? And there's a follow-up question.
Yeah, Nurse Practitioner Brita mentioned the dose is smaller than the adult dose, which is different from the adolescent or older kids dose as well. Yes. Okay,
so for families whose child is almost 5, they're 4 3/4, should they wait for the larger dose or go for the younger dose?
We recommend getting the vaccine now, because COVID is still out there. So I wouldn't wait for them to reach 5 to start.
Okay. So when they go into the clinic, they'll know what the proper dose is for their child based on age and size.
That's correct.
Okay. All right. Has the COVID risk changed for kids? Remember early in the pandemic, we were like, kids are okay. It's old people we have to worry about. has the risk changed at all with all the different variants? Are children more at risk now than before? Or and that's open to anybody who wants to answer.
Sophie, you want to take that?
Yeah, I can answer. Definitely as variants have come on board, COVID has changed and transitioned, and the risk may have been more increased. We did see in the Omicron surge more pediatric cases and pediatric children who were hospitalized, and that could be because of the change in kind of the variants of COVID, but also there was just a lot of COVID. I think we initially didn't see a lot of COVID initially for a lot of factors in children. The schools were closed. They weren't seeing a lot of people. They weren't doing a lot of things. And COVID, in comparison to adults, it does seem to affect children less, and COVID was affecting a lot of adults and causing a lot of severe outcomes. But we did find, and we did learn as we learned about COVID, and we continue to learn about COVID, that it does affect children, and maybe slightly different as we see different variants, but it always has affected children. And it does cause the hospitalization and does cause deaths, and we've seen that throughout the pandemic, but just at a lower level when you compare it to adults. And so I think things do change with variants. Variants may cause slightly different, more transmission in different places or people, but we definitely know that it does affect kids and will continue to affect kids as we continue to see COVID for I would probably say forever, but for a very long time. It's with us.
Okay, all right. So this last question is one of those, how do you guys run your own lives? So are your kids vaccinated? Nikki had said earlier, yes, her daughter has been vaccinated. What about you guys? Have your children or your children in your family all been vaccinated?
Yeah, I have a 10-year-old daughter, and so she got vaccinated. She actually had got COVID initially, and luckily recovered, and then got vaccinated, both 2 doses, and then also got the booster this summer.
Okay, all right. What
But
about
we
you?
still wear masks everywhere.
Yeah, excellent. All right, and Dr. Mercurio, what's the situation in your life?
I don't have kids, but I do recommend all of my cousins and soon to be nephew that they get the vaccination as soon as they can and are eligible, because I do think it's important to protect the young ones in my family, and do kind of continue to recommend and review that with them.
I know within my family, we've made that a criteria to be invited to family events. If you're not vaccinated, you're not welcome to come in, but we'll send you pictures. So it's good to see them. All right, so I want to wrap this.
John, I also just wanted to put out there that, and I think my pediatric colleagues feel the same, is, as a mom myself, as a pediatric clinician, I would never recommend something to a patient that I would not absolutely do for myself and my children. My patients, I hold dear. I am a partner in their health, and I take great pride in doing my research. It's my job to look into this and know about it so that I can help share that information and knowledge with my patients, so that they can make these health decisions for their family, and knowing that I would never recommend something that I wasn't 100% behind and would do for my own family as well. And I have. My kids are fully vaccinated. They've also gotten their boosters. They just recently got their boosters a few weeks ago. I'm so excited about that too. So I hope I don't speak for you guys, but I know that that's a pretty common thread amongst our pediatric colleagues, is that, we definitely feel that way.
Okay, all right, thank you. Okay, so now I'm going to turn it over to Dr. Mercurio to talk about resources that are available. You saw a couple of sites that were listed. Are there any other resources we need to know about?
All the resources that are available, we have a lot on our website, that cchealth.org, or you can go straight to the coronavirus website, the coronavirus.cchealth.org. And we have information about vaccinations, information about testing, a lot of FAQs that we get a lot of questions. And so they have responses online to answer any questions you may have. And so just a wealth of information on our own website. There's also, I know there's a lot of questions about COVID-19 and the vaccine at thehealthychildren.org has a lot of good information and FAQs for COVID-19 vaccine, particularly for this age group, the 6 months to 4 years old. But also for all age groups and other resources that families can look at. Okay.
All right. So we're going to mail out those links and resources to everybody who's registered for the webinar. Some of the takeaways today, it was a fast hour. We were like, oh, what are we going to talk about for an hour? It seems like we could have another hour. But what's important is realize that COVID is still very much with us. Now's the time to protect yourself and your family, especially your youngest kids. That opportunity is available to us, and hopefully we'll see an end to this eventually. If not, just let's be as safe as possible. Continue wearing your mask, and if you have any questions, speak directly to your healthcare provider. They will give you all the information you need. And I welcome you to call Camilla at First 5. She will direct your call to the right person. Okay, so thank you, everybody. Thank you to our panel for being here today. That was very enlightening, and I enjoyed every minute of it. And I really respect all your expertise that came across, and that's wonderful. So thank you, everybody. And hopefully we won't see you for another webinar because this will come to an end. But if it doesn't, we will be back with more information when the time comes. Thank you very much.